Welcome to our session on implementing allergy management in schools, launching a new model policy. I'm Sarah Baker from the Anaphylaxis Campaign, and I'm here with my colleague Maggie Young from Allergy UK. We're presenting this on behalf of our respective patient charities and the BSACI. We're going to take you through how we developed the model policy and the key elements within it.
So the first stage in developing this policy was really to examine the need for the policy and to look at some of the data that was going to guide us in its development. I think one of the key standouts from this slide is the point about the call by coroners following the death of 2 children from anaphylaxis for more definitive guidance for schools around caring for pupils with allergy and keeping them safe. So this was a really key factor in guiding the work that we did here. And the other aspects that I think are interesting and indicate that need is around the fact that most school classrooms will have at least 1 child with allergy. So that's a very powerful message, I think. And also that when we look at anaphylactic reactions amongst children, amongst pupils, 17% of those actually happen when children are at school. So those are the that's this kind of information that really guided us in developing this policy and identifying a need for it in schools. The approach that we took was very collaborative, and we put together a working group which comprised ourselves, Allergy UK, Anaphylaxis Campaign, BSACI, and we were very much supported by the Medical Conditions in Schools Alliance and also by the Department for Education, who came to the initial meetings when we began to plan the development of the policy. They were very supportive in that process. And I think the first key step that we took, and really was the cornerstone of our approach, was looking at the current legislation that was around this issue and looking at it across the 4 nations. So this was very much a UK approach. We also looked at some of the work that our 2 charities have done around this space, and we have resources that have been very successful and that we use a lot, including Allergy Wise. We have the School Allergy Awareness Group, which is an online toolkit for schools to help them through the process of developing a policy, key stage resources, spare pens in schools, and so on. And what we were really working towards was the development of a gold standard policy for schools, something that was clear, something that they could integrate into policies around health and safety and so on. But we included in that a template working policy as well, so that they could really have all the tools to lead them to developing their own policy for their individual schools. So, as I've mentioned, schools have a great number of policies that they have to work with. So we really did want to integrate this within existing policies. And the health and safety policy was key to this. An allergy policy has to be read in conjunction with the school's health and safety policy. Designated first aiders should have specific training in anaphylaxis. And school governors and school teachers, we also wanted to remind governors and the whole school really of their responsibilities in terms of keeping pupils with allergies safe, and the duty that they have to ensure that staff are properly trained in allergy. Sarah.
As Maggie said earlier, there is statutory guidance for schools in supporting the allergic child and managing anaphylaxis. From the 1st of October 2017, the Human Medicines Amendment Regulations has allowed schools in the UK to buy adrenaline auto-injectors, devices known as AAIs, without a prescription to use in an emergency on children who were at risk of severe allergic reaction known as anaphylaxis, but whose own device is not available or not working. Both Allergy UK and the Anaphylaxis Campaign encourage schools to purchase adrenaline auto-injectors though we believe this is still only a small percentage of schools that do in fact purchase AAIs. Schools must encourage parents to ensure that their child has an up-to-date allergy action plan and that all the staff know the detail on these plans so that they can be responsive to a child should they have an allergic reaction. The risks of cross-contamination need to be considered, whether this be through an arts and crafts lesson, home economics, or in the dining hall. And risk assessment is key to keeping the allergic child safe, and we provide links to model risk assessment tools within the policy. Maggie has already touched on training, but this cannot be overemphasised, as this is the key to keeping the allergic child safe and is sadly a recurring theme in the prevention of future death reports. The policy provides links to free training for schools. Both charities receive calls from school caterers about how to provide safe meals for the allergic child. And key elements to achieving this are that all staff, including catering staff and lunchtime staff, must have allergy training. All staff must know who the allergic children are and be familiar with their allergies and have discussed these with the child's parents and carers. All staff must be familiar with the child's allergy action plan and know what to do if the child has an allergic reaction. The important fact is that no child should be discriminated against because of their allergies, and that the school and school caterers must be able to work with the child and family to ensure the child receives a school meal. Ultimately, school caterers must follow the Food Information Regulations 2014. So, how do schools work with parents and carers to keep a child safe? When a child joins a school and at the beginning of the school year, parents and schools both have an obligation to work together to ensure that they know how to support the child who may have an allergic reaction or be at risk of anaphylaxis. The child's allergy action plan is key to keeping the child safe. It's a dynamic document and is not meant to be locked in a cupboard. It should be accessible at all times and reviewed and updated by the parents as needed. And the allergy action plan should also cover extracurricular activity. Parents and carers have an obligation to ensure that the child's adrenaline autoinjectors are in date and of the right dose for the child. And the school's responsibility is to ensure that they are kept near the child and that all staff know how to use them. It's important for schools and parents alike to recognise that each type of adrenaline autoinjector works slightly differently. We recognise that as we were developing the allergy policy, there's a huge amount for schools to think about and for schools to consider when they're aiming to keep a child with allergies safe. So, as a part of the policy, we have developed an allergy management checklist. This allows the schools to ensure that they cover everything from policy development to training and storage of AAIs and how they can purchase spare AAIs for their schools.
We wanted to use all our communication channels to get as wide a reach as we possibly could for this policy, to reach as many schools, as many parents. So we used our own communication channels for both charities. We have, of course, databases of parents and schools, our school contacts. So we really wanted to spread the word. It was presented as a soft launch at the BSACI conference by Professor Adam Fox. We did some media work around it and we were able to mail directly to our school's database. So it was actually going directly into schools, which worked very well for us. Our individual members and supporters, we spoke to them about it. And websites, obviously it's on our websites, but we're really keen to promote this in an ongoing way. This isn't something that's just done and dusted. I think there are two things. One is, as Sarah says, it's a dynamic policy. It's something that we'll be looking at, revising if we need to, changes in legislation and so on. But we really want to use it as the cornerstone of a lot of the work we do with schools during the school year, and to do that outreach. So to remind, to do that ongoing promotion that we feel is really important, as it's become such an important piece of work that we've done together. It's difficult to estimate the importance of parent feedback, because clearly parents play a very important role in all of this. And so right at the beginning, we talked about how we talk to parents and get some feedback about what they felt about what we were doing and how we put this policy together. And this is just an example of that feedback, which really reassured us that this was a comprehensive, a robust, but an accessible policy that parents would support and play a very important role in. Finally, just to quickly run through some of the resources that both of our charities already have in place. So this is part completing a picture for us. So I've briefly talked about the SARG resource kit that we have at Allergy UK, which is an online toolkit for schools to work through the process of developing a policy. We have back to school resources, and we also have guides for school caterers as well to help them and to support them in providing meals for children with food allergy. Similarly, Anaphylaxis Campaign, they have a lot of very useful and very good resources for schools, allergy awareness resource packs, Allergy Wise, which is an online training course, and again, food service industry guides. So between the two charities, there's a lot of information that can be very helpful in this space. Finally, I just want to highlight where the policy sits. It's on the BSACI website, it's on our website, and it's on the Anaphylaxis Campaign website. And it's something through our helpline, for example, where we get a lot of calls. Both our helplines get a lot of calls from schools. This is something that we can signpost very effectively to, and will become an important part of the work that we're doing with schools going forward. Thank you.